Alright, so looking at the next example of Clostridium, looking at the next example of Clostridium is the Clostridium difficile. Alright, Clostridium difficile. Alright, so they said are obligate anaerobes, so they do not actually need oxygen to survive. So the Clostridium difficile, most of the times when you see it written, it's just written as well C difficile or CD. It's a gram-positive, spore-forming anaerobic bacterium. So it usually cause conditions like what? Or cause disease conditions like what? Diarrhea, colitis, and all of that. For the domain of this, it is a bacteria. Phylum is Bacillota. Class is Clostridia. Order is Clostridiales. Family is what? Clostridiaceae. Genus is Clostridium. Species is Clostridium difficile. Right? So when you have infections from this Clostridium difficile, these are the various symptoms. Watery diarrhea, having blood in stool, persistent abdominal pain, swollen or distended abdomen, nausea and vomiting, loss of appetite, fever, rapid heart rate, and all of that. So what is this description? It's an obligate anaerobe, meaning it can actually survive in environments where there is no oxygen, right? So it's not motile, it can produce spores, and these spores can actually survive for a very long time, even when the conditions are harsh, okay? Pathogenicity, we say that it is a leading cause of what? Antibiotic-related diarrhea. Cause a wide range of what? Um, Symptoms from mild diarrhea to what? Life-threatening colitis, okay? So it can produce a lot of toxins, toxin A, toxin B, right, and all of that. For infection mechanism, antibiotic use. The use of broad spectrum antibiotics can disrupt the normal gut microbiota, right? So you use antibiotics, and the antibiotics will now kill some kind of bacteria that they are not supposed to kill. You understand? It also lead to then also spore injection is when the spores are ingested from contaminated surfaces, right? Then colonization and toxin production. So once in the colon, the spores will germinate. The bacteria will now produce toxins that will now damage the intestinal linings, and this is what will lead to all these symptoms that we're seeing. Right? The clinical manifestation, it can cause mild to moderate diarrhea, severe colitis. There's some complications. That's when you're having toxic megacolon, perforation of the colon, sepsis, and death ultimately. All right, so that's it for Clostridium difficile.